right, so for today's simulation, it's going to be Aria Stark as their patient. Date of birth is going to be August 9th, 2000. She's coming in for an altered state of level of consciousness, and we're going to be giving her Narcan, 0.4 milligrams in the muscle as soon as we go in. Dr. Who's the one that ordered it. Expiration date is good. And then I'm gonna draw it up. So when I draw up a medication out of a vial, we always make sure that we swab the top of it just to make sure there's no bacteria, make sure it's sterile. And then we're gonna draw up 1 milliliter of this of air, just so that we can push that back into the vial. And then it makes it easier to draw the medication out to the 0.1. I don't want to open this just so that I can keep reusing it at the moment. Hi, I'm Taylor. I'm gonna be your nurse today. My Aria? Dad, is this Aria? Can you just verify her name and date of birth for me? Perfect. All right, so it looks like the doctor ordered some Narcan just to help her kind of come down from whatever she had taken today. So Narcan is basically a reversal agent for opioid use. So if she took too much, she started having an overdose, so the Narcan reverses that. Some things to look out for is her blood pressure may skyrocket or it may go down, so we're going to keep her hooked up to a blood pressure monitor just to keep an eye on her. And then she may have some nausea and vomiting, so just make sure that if that starts happening, you either call us with the call button or have a trash can ready for her. Okay, so I already drew up the medication, so that's what I'm gonna be giving her. Let me put on some gloves, and then when I'll come back and check on her in a few. All right, so we're just gonna scan the area, beep, scan the medication. Yes, I'm using soap. All right. And this can go in her leg or her arm, just depending on how much is ordered. All right, so we're gonna come back and check on you in a few. Let us know if you guys need anything, all right? For the next patient, we have Simmons, date of birth 10/31/66. He has no known allergies. He's coming in for a headache. The doctor ordered to give to him now Tylenol 500 milligrams by mouth. So just checking the medication, Tylenol 500 milligrams, expiration date, lot, they're all still good. So we're gonna put that in there unopened. We're gonna have a cup of water for him, and Hi Jean, I'm Taylor. I'm gonna be your nurse today. It looks like the doctor ordered some Tylenol for you for your head. Have you taken it before? Have you taken any today? No? Okay. What's your pain level at right now? What do you usually have it at when it comes to be unbearable? Okay, anything below a 3? All right. Do you have any trouble swallowing, taking any medications? No? Perfect. All right. So just watch out for any nausea, vomiting. Let us know if that starts happening, and we can probably get you some other medication like some Zofran just to help with that nausea. When you're at home, make sure you take it with some Tylenol or with some food. Don't take it on an empty stomach. Take it as directed, and no alcohol. And then we'll come back and check on you. Can you see your bracelet? Beep. I'm gonna scan the medication. All right. Go ahead and take that. And then let us know if you have any questions, okay? Okay, today we have Julia Child, 12/12/12 is her date of birth, no known allergies. She came in for a burn on her hand. We're gonna give her an injection of the ampule. So with this, we'll take the piece of it, we'll have gloves on, have a paper towel wrapped around it. We'll break off the top of this, discharge the top of it so that we don't have any glass laying around that can harm anyone. We'll draw up some medication. It looks like they only ordered 1 glass of it, and there's only 2 ml. So this will go either in her thigh or her glute. And then the expiration date is good. The expiration date's actually expired. But we're gonna act like we're back into the future, apparently. Or in the past. And then lot number. Hi, I'm Taylor. I'm gonna be your nurse today. Are you Julia? Hi, Julia. It looks like you got a burn on your hand today. How's she doing, Mom? Doing okay? All right. Can you just verify your date of birth for me, sweetheart? 12/12/12. Perfect. All right. So it looks like for the medication, or the doctor ordered an injection. This is gonna go in her thigh. Mom, does she do okay with shots? Yeah. Okay. Perfect. So this will help with any kind of underlying infections. Does she have any allergies that you know of? No? Perfect. Okay. So I'm just gonna put some gloves on, sweetheart. How's your hand? Does it hurt? What's your pain level? Is it like, oh my goodness, it hurts so bad in my life? No? Okay. So we're just gonna do an injection. And before that, I make sure that I verify. Scan the bottle. It's kind of harder because we have paper. All right. So we're just gonna do it in your thigh. Ready? 1, 2. Perfect. All right. So I'm gonna come back and check on her in a little bit. If you guys have any questions, just let me know. The call light is right next to her. Do you guys want to need some water? Yeah? Yeah, sound good? Okay, I'll be back shortly. John Doe, 8/19/1994, came in for an allergic reaction. He was prescribed by Dr. Who some prednisone, 5 milligrams to take 3 times a day for 3 days. Prednisone. We're gonna check the expiration date. That's good. Make sure we have the correct medication, 5 milligrams. We're gonna put it into a cup, have some water available for the patient. My name's Taylor. I'm going to be your nurse today. Are you John? Hi, John. All right. So it looks like you came in for an allergic reaction. The doctor is going to prescribe or give you some prednisone. Have you taken that before? No? All right. So this is a medication. It can help with allergies, sinus infections, a couple different things that helps with the inflammation and brings that down. Can you verify your name and date of birth for me? 8/19/1994. Perfect. Do you have any difficulty swallowing? No? All right. So go ahead and take this for me. All right. I'll come back in and check on you shortly, okay? Okay, so today we have Linda Belcher. Date of birth is 9/4/72. She came in for arterial fibrillation. The Doctor Who ordered some Coumadin, 5 milligrams to take by mouth to give right now. And then we got the medication. We're just gonna check the date or the name, amount, expiration date, lot number, just to make sure those are all okay. And then we checked her labs, made sure that where her PT-INR was at the moment, making sure that it's not too low or too high to be dangerous. We don't want to give it if it's within range, because that can make her even more sick and the numbers all off the chart. Hi, I'm Taylor. I'm going to be your nurse today. Are you Linda? Hi, Linda. So it looks like the doctor ordered you some Coumadin today because your INR is a little too high. You take this, right? Yeah. Did you take any today? No? Okay, perfect. So I'm going to give you some. Do you have any difficulty swallowing? No? Okay, perfect. So I looked over your labs. Your INR is still pretty high from when you were at the primary care. So I'm going to give you some Coumadin, 5 milligrams, and then we'll take some blood samples, check back in on you. And then because you've taken it before, you know the interactions that it can have. don't eat anything with high calcium. If you already have that in your diet, go ahead and keep what you're doing, just don't increase. How's your diet? Any salads? Yeah, okay, so just make sure that you don't eat too much of the salad because that can interfere with the Coumadin. All right. Perfect. All right, go ahead and take that for me. Awesome. All right, so I'll come back in and check on you shortly. If you have any questions, go ahead and just give us a call on your call button, and we'll come back in and talk to you, okay?